Good afternoon, everyone. I'm Jamie Sherman, and today we're here with Dr. Krista Lentine, a board-certified SLU care physician and nephrologist, the medical director of the Living Donor Kidney Transplant Program here at SSM Health St. Louis University Hospital. And along with her is Dr. Henry Randall, a board-certified SLU care transplant surgeon and the director of transplant services at SSM Health St. Louis University Hospital. Thank you both for joining us today.
Thank you, Jamie. Thanks for having us.
Yeah. Today we'll be discussing kidney transplantation and the strategies and tips for starting the conversation to find a potential living donor. We'll take questions live throughout today's presentation, or you can ask a question in the comments area of this post. So Dr. Krista Lentine, we'll start with you today. What treatment options do individuals have if their kidneys fail?
Thank you, Jamie. So when the kidneys fail, in broad terms, the treatment options are dialysis or transplant. And briefly, dialysis uses a machine to do the kidney's job of cleaning the blood and removing waste products. There are two main forms of dialysis, hemodialysis and peritoneal. Hemodialysis requires that patients come to a center and receive these blood cleaning treatments that last about 4 hours 3 times a week, whereas peritoneal dialysis is done through nightly treatments every night at home. Both require big time commitments, can have complications, and really cannot do the complete work that a healthy kidney does. So transplant is a superior treatment for kidney failure for a number of reasons, and we'll discuss those reasons throughout this program.
Great, thank you. So our next question, how many patients in Missouri are on dialysis?
Currently, there are approximately 6,000 patients on dialysis in our state of Missouri, and in a broader context, about 450,000 patients are on dialysis across the country right now.
Wow. And then, so you mentioned this. How many people are waiting in the U.S. for a kidney transplant?
So currently about 100,000 persons are on waiting lists for a kidney transplant across the country. And this includes about 1,600 people listed for transplant in the state of Missouri. And we mentioned that transplant is a superior option, and really one main limitation to broader use of transplant is that we have an organ shortage. Last year, there were about 14,000 deceased donor transplants performed in the country, and that was actually a milestone year and should be celebrated, but if you compare those numbers, it's obviously not enough to meet that need, and that's why we're talking about living donation. And I'll segue to Dr. Randall to talk a little bit about waiting times and how he counsels patients about the wait they can expect for a deceased donor.
Sure.
Can you handle that?
Sure, absolutely. Waiting times around the country vary by population density and also by blood type. Blood type O being the most common around the country tend to wait the longest for a deceased donor transplant, followed by blood group A. ABs can wait a fairly long time, but they tend to come up fairly commonly. And then Bs also have a fairly long wait time. Here in Missouri, a blood type O can wait up to 5 years to receive a deceased donor transplant. A blood type A can wait 3 to 4 years before they are receiving a call to receive a kidney transplant.
Now, Dr. Randall, is there an age range to be an eligible kidney transplant recipient?
Sure. So we will look at all patients essentially of about any age. We tend to become more critical the older patients are. We don't have a strict cutoff, but we get very, very critical when patients are over 75 years old. Between 70 and 75, we're fairly critical. But we're critical of all patients because we want patients to live quite a long time after transplant once they actually do receive an organ.
Great.
And I would like to transition on that point that actually for older patients who are in good biologic health, that living donor transplant can actually be a superior option for them because it can allow them to receive a transplant more quickly rather than waiting on a waiting list when their health may deteriorate and they may become too sick for a transplant.
That's absolutely right. And again, just to continue that point, if you are in the 70 age range or even the upper 60s, we will emphasize that that candidates try and find living donors so they don't have to wait that time period that I outlined earlier. So we do emphasize living donors for older patients.
So tell me, Dr. Randall, how long does a transplanted kidney last?
Vast difference between a living donor and a cadaver donor. A cadaver donor, on average now, will last a patient around 7 to 8 years, and it's about 12 years for a living donor. So that's quite a distinct difference.
That is.
So the advantage goes to the living donation in this case.
Dr. Lentine, is it true that kidneys from a living donor offer better outcomes?
Very much so. And so transitioning on what Dr. Randall just said, that among transplant options, living donor transplant are superior for several reasons. They can offer the fastest time to transplant, reducing or even preventing the need for dialysis and its associated risks. And then kidneys from living donors also tend to work better, and this is for several reasons, in part because living donors are selected for excellent health to protect the donor, but that has benefits for the recipient, and also because the process of procurement from a living person is less stressful to the donated organ. And so that feeds into those survival times that Dr. Randall just mentioned.
Now, tell me a little bit more about patients who can live longer than those who remain on dialysis after a kidney transplant.
Sure. So with this combination of better allograft function, the patient survival outcomes after living donor transplant are also superior. So one statistic that we often quote is that 5-year patient survival after a living donor transplant is approximately 85%, compared with 75% for a deceased donor transplant, and compared to only 40% for patients who remained on dialysis. So really very stark survival differences, particularly compared to dialysis.
Dr. Randall, does insurance fully cover a kidney transplant?
A little bit difficult question, but in part, yes. Sometimes we will have our social workers work directly with patients. Some patients have to have a supplemental insurance plan. In particular, it's important to make sure that the medications are paid for, at least for the 3-year period. If you're a Medicaid patient, sometimes your Medicaid can drop off at the end of 3 years, and we want supplemental insurance to make sure that insurance takes care of the transplanted organ for longer than that period of time. So both a combination of third-party insurers or third-party insurance plans plus or minus Medicaid, Medicare.
Okay. And can you tell me, since you're a surgeon, how long does a kidney transplant take?
On average,
The operation.
Yeah, sure. So sometimes people are expecting to be in the operating room for a long time. They're probably in the operating room for 4 or 5 hours, but the actual operation itself takes roughly about an hour and a half to 2 hours to perform. So there's some lead time where anesthesia is getting a patient to sleep, getting them prepared for the transplant. There's the actual transplant event itself, the operation, and then there's a time waking the patient up and getting them prepared to go to post-op recovery.
Okay. So I'm out of surgery now.
Right.
I've got my kidney. How long can I expect to be in the hospital?
Typically about 4 days. That's fairly standard. You'll go to a post-op recovery setting for about an hour. Depending on the patient's age and medical conditions, you may require a short stay in the intensive care unit, or you go directly to the transplant floor, and the rest of your recovery time is receiving your medications and getting back to your activities of daily living, and then having the catheter taken out that we measure urine and ensuring that patients can urinate fine after the catheter comes out. There's no evidence of rejection or infection. They know their medication. Patients go through a teaching session before they're discharged from the hospital, a big instruction packet. Besides Dr. Lentine and I, you'll see a swarm of people seeing the patients, the pharmacist, the social worker, the dietitian, the outpatient coordinator. So there are a number of people that see the patient during that 4-day period and getting them prepared for their life after the transplant event.
Great, great. So let's move into living donation now. Talk to me a little bit about what living donation is.
We'll take this together. So
yeah,
let's-
that's
Switch back and forth.
Yeah.
So just very briefly for kidneys specifically, which is what we're talking about. In brief terms, it is the removal of one kidney from a healthy person and then transplantation into another person.
Okay, in its simplest form.
And it's very
And it's a little more
Very
complicated
complicated.
than that.
Right.
But in its simplest form, we look for people who are extremely healthy.
Oh, yeah.
She did mention that, but we don't take patients and remove kidneys out of unhealthy people, because you can do harm to the donor, and that's not our objective. We don't want to do any harm to the donor just to benefit a recipient.
So let's talk about who can be a donor. Like what's the eligibility for that?
So really a key point that we emphasize to all donor candidates is that their evaluation, their assessment is all about them and ensuring that it's a safe procedure for them. And actually we have a separation and a separate team focused on living donors so that the recipient's need doesn't play into that. So donor candidates undergo really a very careful evaluation. It's a full process to be evaluated for a donor, and this is to assess that the health risks are suitable such that they can safely undergo surgery and so that they can also live a long life with a healthy kidney, and also that they're in a good sort of psychosocial position to tolerate the donation process.
Okay. So how long does the process take to be, I know this is off of our script, but how long does the process take to go through all of the testing to be an eligible donor?
It can really vary. So we have had cases where people come in, they contact us, really as Dr. Randall alluded to with the comprehensive team, when someone comes, they're seen by a number of different team members, but a full evaluation can actually be done within a day. And then the process after that may depend, is there additional testing, follow-up issues, and so forth. And then another thing in terms of proceeding with living donation and transplantation is that the recipient is ready. And we usually begin it when the recipient is ready and enlisted, but dynamic health changes can occur that could introduce some delays. So we can't promise a time frame. In other words, someone comes in and I want to donate on this date. They have to understand that there are contingencies.
Now, do you have to be related to the person needing a kidney to be a match for them?
Actually, you don't. If you think about cadaveric donation or brain dead donation, the great majority of people are not related to those patients. However, there is, again, a immunologic benefit if you are related to the recipient. We look at what we call antigen match, and antigen match does matter from an immunologic standpoint. You get some sort of protection, if you will, from that, but no, short answer is you don't have to be. If you are in a book club, church, social group, anyone who's blood type compatible can be an organ donor, a living donor.
Now, we do have, our first question has come in.
Okay, good.
We've got lots of comments, so thank you all for commenting. But our first one comes from Jeff Wright out of St. Louis, and he wants to know, can my children be living donors before they're 18?
No, the short answer to that is no.
No.
Right. So there are actually policies for the practice of transplantation. These are government policies established by an organization called the United Network for Organ Sharing, and there are some mandated exclusions, and one is that donors are at least age 18. There's actually very rare exceptions where someone less than 18 who has full knowledge of risk can proceed, and those are usually in like a young woman who donated to her child. There have been rare cases of like a 17-year-old mother donated,
Okay.
but in general, no, it's for adults.
Okay, very good. So moving on here, we've got somebody on here, Ramen. She says I think it's a she, according to the picture. I'm looking for a donor waiting in Seattle. Do you have any advice for her? She's waiting in Seattle. And
Seattle.
she's looking for a donor. Do you have advice for her?
So yeah, ask, and again, I mentioned the social groups. It was frowned upon years ago by people in the transplant community to use social media as an outlet or a pathway or avenue to ask, for donors. That stigma, at least in the transplant community, has gone away. So use social media, Facebook, Twitter, LinkedIn, Instagram. People ask all the time. But again, ask those close to you. Ask your classmates if you're a student. Don't just walk up to a stranger and ask. Probably wouldn't recommend that, but start with people close to you.
Okay. And I just want to let you know, we'll talk a little bit more about methods on how to ask that all difficult question.
Right.
Again, some more questions are coming in, so I want to get to these while we can. Sith is asking, if someone is asthmatic, are they able to donate?
Asthma would not fall out as an absolute exclusion to donation at all. We wouldn't. Basically, there's a comprehensive medical assessment, and any concerns for tolerance of surgery or for a long, healthy life would be an issue. So, perhaps if patients had a lot of respiratory failure or something in that regard, but no, in general, it should be okay.
A couple more. Emily is asking, are there programs to help with the cost of living donor expenses, like time off work, transportation, et cetera?
Absolutely, so we can talk about that. So just as some core principles about the cost of living donation is that Medicare or the recipient's insurance covers the cost of all the evaluation testing, of the donation surgery, and of the early post-donation care. So donors should not ever pay for that. Occasionally there's issues where if they have private insurance, they might get a bill, and those should be discarded. So all of that should be covered. But the questioner is correct that there may be some indirect costs related to traveling to the center or from lost time from work. And notably, the National Organ Transplant Act has been clarified that it's quite legal to cover those costs. But the issue is that as a community, we know that the mechanisms are far from perfect. HRSA has established something called the National Living Donor Assistance Act, and this provides grants related to travel and lodging related to the donation process. People have to apply for that, and there are some income-related criteria. But there are a number of nonprofit programs involved. So in Missouri, we have access to the Missouri Kidney Program that is involved in providing those type of grants. Regarding the wage issue is actually quite a hot topic in the field, and there are several clinical trials that have been just launched to try to understand the role of wage replacement. Again, it's legal, but there are not a lot of mechanisms available for that. And again, we've been very successful with the Missouri Kidney Program for donors who may incur some wage-related issues, getting some small grants.
Good. Our next question comes from Kate, and she's asking, are there better outcomes if you receive a transplant prior to starting dialysis?
Short answer to that is yes. And what she's talking about is preemptive transplantation. So there are some candidates, as Dr. Lentine alluded to earlier. We talked about the treatment options for end-stage renal disease, dialysis, and transplant. But if you find a living donor, then you can have what's called a preemptive transplant, meaning you get your transplant before you go on to dialysis. And Christy,
yes, and in general, so that is quite a beneficial option. There are survival benefits, but one thing I do counsel patients is to not be highly alarmed if they record. So if they've started the process, they're being worked up for transplant, their donor's being worked up, if it comes to a point in their health where they need a short period of dialysis to clean their blood and prepare them for surgery, that is not a disaster or the end of the world at all. It doesn't have a big impact on outcomes. What does impact outcomes is a very prolonged period of dialysis because, as we said, it's an inferior treatment. The body wears down.
Good. Let's see. We've got, you may recognize this name, Heather Bear. Do we all know Heather? Her 3-year-old son, Blake, had his transplant at Cardinal Glennon, and his living donor was Lori. she's on watching today, and
Hi, Heather.
she would like to know, how far off do you think we are to a 3D printed or artificial kidney?
So I'll take that one because that's a particular interest of mine. Honestly, I think somewhere in the next 5 to 10 years, we might be close to that. So there are programs around the country now that have centers focused on tissue engineering or regenerative medicine. And we're at a point where they're starting to separate the scaffolding, sort of the framework, if you will, for organs, separating that from the functional or the parenchymal cells. For me, all of it is functional, but finding industrial biologic printing with tissue engineering, I think it's going to take a lot of collaboration. Independent centers are going to have to start working together, but somewhere in the next 5 to 10 years, I think that's going to be a true reality.
Very cool. She also notes, do you foresee there being a time that anti-rejection medication will no longer be needed?
Hopefully, in part of the 3D, 4D, 5D printing arena, the need for immunosuppression would also go away, because what you're then looking at is combining this term that people use now, you might hear, called precision medicine, and that's where they take cells from the recipient, could be a hair follicle or fat cells, and they get your DNA, and then they print an organ specifically for you. That means that it's not antigenic, or it doesn't, you don't develop an immune response to it. So hopefully the need for immunosuppression may also go away.
Good, very good, thank you. So thank you again for those questions, they're fantastic. We'll move on a little bit, and Dr. Lentine, I'd like to talk about the different types of living donation. What are they?
Sure, and I wanted to actually, there's one key theme that I wanted to bring out, going back early in the conversation when you were talking about relationships, and Dr. Randall spoke about matching, but there's the concept of biologic compatibility, meaning that the donor's blood type is compatible with that of the recipient, and that the recipient doesn't have preformed antibodies. So that's the main thing that we look at in a directed donation. But something really important to understand is that in the last decade or so, there's been new strategies to allow healthy, willing persons who are not biologically compatible with their recipient to make transplants happen. And a key form of that is something called kidney pair donation. And basically what this involves is swapping pairs of donors. So I want to donate to Dr. Randall, I'm not compatible, there's another pair with that situation, and the donors can be exchanged. And so that's really important to understand, that if someone comes forward, said they've been screened but they're not the compatible blood type, or that they can still help by participating in these programs. But regarding forms of donation and tying off that, so directed donation is when someone comes forward to donate to a specific recipient, so either to a family member or a friend. And sometimes people who have never met a recipient may hear a story on social media or through various mechanisms and want to donate to a specific person. That's directed donation. Non-directed donation occurs when someone just has heard about kidney donation, giving the gift, and comes to a program and says they would like to donate. That used to be called altruistic donation, but the community has recognized that all living donors are altruistic in giving of themselves. So the current term is non-directed. And there's about 250 of those donations per year. And those donors are particularly important and impactful in their gift, because often they can give into an exchange and allow multiple transplants to happen.
Okay, very good. We've touched on this a little bit, but I just want to review this. What are the advantages of living donation, Dr. Randall?
So again, the advantages are biologic, as Dr. Lentine mentioned. If you have tissue matching immunologically, that would offer you a benefit to have your kidney potentially last longer, sometimes need less immunosuppression, but we can't predict that up front. Everyone is a little bit different. You can get transplanted quicker. and it prevents some of the complications associated with dialysis, peripheral vascular disease, cardiac disease in particular, and it can lessen the time that a person spends on dialysis. And with the ravages of dialysis, sometimes people are not candidates for transplant any longer because of the associated complications with dialysis. So the sooner they come to transplant, the better off people are.
Mm-hmm. So we've talked a lot already about the benefits of receiving a kidney from a living donor. So, you know, let's talk a little bit about what are the risks of somebody who decides to donate a kidney.
Well, there's no such thing as a risk-free surgery or risk-free medical procedure. So donation obviously involves surgery, which has the associated risks of anesthesia, bleeding, infection like any surgery. Those risks are actually lower than risks such as having the appendix removed or gallbladder. In terms of, and I'm giving the information that we disclose as we counsel donors. In terms of the risk of a perioperative death, that has been death within 90 days has been estimated at 1 in 3,000 or 0.03%. And that estimate actually does include some unrelated events like if a donor died in a car accident or the all cause, so some unrelated as well. One important advance in the practice of the donation surgery that Dr. Randall can talk about is the advancement of minimally invasive or laparoscopic approaches. So that is now standard of care. That approach compared to the open procedure allows much more rapid rehabilitation after donation surgery so that donors can return to their normal life and activities much faster. Hit one other key point in that, of course, if someone is living life with one kidney, we care about the long-term function, of that one kidney. And just in terms of what we know in that regard, so we've been able to do, everyone who's donated a kidney in this country is known because they're registered in a national registry. And we also know all people who develop kidney failure because those events are recorded as well. So combining that information, we could have a good idea of those long-term outcomes. Overall estimated across the lifetime, less than 1% of living donors go on to failure of that remaining kidney. And it's important to note that that is a third of the average kidney failure rate in the general population, indicating that we do a good job of screening donors for good health. It is also important to know, though, that donors have a fraction of a % increase in the risk of kidney failure compared to estimates that have done in healthy persons who do not donate. So we do disclose that information, and our message in that regard is that if someone does this, they're making a commitment to their own health. They need to follow with the transplant center, with their doctor, not smoke, not become overweight, and just have checkups so that if any problems occur, that they can be promptly treated.
Dr. Randall, what kind of recovery time is there for somebody who donates their kidney?
So in brief, most donors are in the hospital only 2 days. So their stay is actually shorter than the recipients. We talked about the recipient stay being about 4 days. The donor stay in the hospital is only 2 days. So again, we're looking for them to recover their renal function, make sure that they are able to urinate okay, that they can attend to their activities of daily living, they're eating fine, no infection, their wounds, small wounds, are healing well, and then they're sent home. Depending on what type of work a person does, you can be off of work as short as a few days. It may take you a couple of 3 weeks to return to work. Some light duty work, if you're a laborer and you're doing heavy lifting, then we tell people, we give them an extended period of time for them to recover. But if you have an office job, a desk job, you can return to work in about a week or 2.
Fantastic.
So it's a pretty rapid recovery.
Fantastic. Dr. Lentine, what are some of the financial costs for a living donor? We
Yes,
talked about that
right.
a little
That,
bit.
that really segues back again, that the cost can be, the evaluation is a process, so it can be related to the costs of coming in for testing, that transportation, that lost time from work, and then any time that's lost from work and recovery if they don't have benefits. But we try to have donors work very carefully with our social worker or with our financial counselor so that they can have access to all support services.
Great. So let's get to that tough question. How do you ask somebody to donate their kidney?
That's a tough question for me, but if I were counseling someone, I guess I would have to tell them they'd have to be direct. I think the way to do that is to say, hey, listen, you and I have been friends a while. I hate to ask this, but I'm suffering from kidney disease, and I was wondering if it were possible that you would be willing to donate a kidney. That seems easy in some regard, but is extremely difficult for some people, and we get that, we understand that. There are patients that will not ask family members, and they will not ask family members until we explain the risks to the donor, and we explain the risks and the benefits to the recipient and the benefit to the donor. The donor understands often the benefit. I'm helping out my mom, sister, my friend, cousin, whomever it is. The recipient is they always feel guilt asking because they don't want to take a kidney away from someone. Let's say, what if something happens to them during the operation, or they get injured and now they have one kidney? I'm shouldering that responsibility. That's difficult, but we try and smooth that out for them and give them some support in terms of how to ask.
So it's a very difficult question to ask, but do you find it best that people just share their story?
I was going to tease a little bit and say that Dr. Randall and I have slightly different personality styles. Maybe he's very direct in person, not that I'm indirect. But I would say another, just that what Dr. Randall described, that process of making that ask, is that it can be, depending on personality styles, can be extremely challenging. So one of the things that we've recognized in recent years is maybe not necessarily to ask, but to share the need. And that's where some of these new strategies have been very helpful. So social media can allow one to just share their story and express their need without reaching out to a specific person to make the ask and say, if you're interested in this, then contact the program. One thing that's very important in terms of communication with transplant programs, that is completely confidential. So a transplant program will never disclose to a recipient that anyone has stepped forward at any point without that donor's permission. So people can feel very free to contact a transplant program to make requests, to do the portions of the evaluation without having that shared, so that they don't feel stress in that regard. Other strategies that have been developed is the concept of a living donor champion or an advocate, and that is designed very specifically to take the burden of asking off the kidney patient. And the way that works is through various education forums. Either we've done kind of a monthly class in that regard. We'll also talk about it in a workshop that we'll mention at the end, where we train a family member how to reach out to the patient's social network to talk about just the basics of kidney disease, why dialysis is so hard, the benefits of transplant, and to share the patient's story. And often just hearing of that need can be very motivating for people to step forward.
Right.
What are some of the most essential tools in spreading the word about living donation?
So did Dr. Randall talked about the
Are we
different
on one today?
technology? Yeah, exactly. Yeah, he's a
We're
technology
on,
pro. So yep.
Yeah, we're on a media platform right now. People have gone on Facebooks, and you've seen them, hold signs, do the sandwich signs. I'm a blood type A, I need a kidney. I live in Seattle, or I live in Washington, D.C. So any of the social media platforms now, I think, are appropriate forms of a method to ask or do the ask.
Can you even like post it on your car as you're driving, like through town? Like, would you encourage
no,
something
not
like that?
necessarily. I mean, people can do what they feel comfortable with. I would say things that are, the yard signs or the cars, maybe that are too identified. I don't necessarily advocate for that. But just in terms of using social media, I'm very much in favor of it as well. But doing it in a safe way, in a way that's non-coercive, in a way that we're using the transplant center as the mediator, so not that donors are contacting patients, those kind of issues.
So when we're on social media and we're making that ask, what do you find is most essential in telling your story, or most effective?
Just so giving some basic information. People like to know the cause of kidney failure, if the patient's already on dialysis, how long, and how has that been. Really hearing. Like I mentioned, the time committed at the beginning, dialysis is a job, and it's a draining, hard job. And just sort of hearing about those struggles can often be, very motivated in a realistic, sort of genuine way. People like to see pictures, so pictures sort of connecting with the person, maybe showing what they enjoy in life activities, those kind of issues. And then again, there are links in. People can draw in information from vetted sources from the National Kidney Foundation or different organizations, just giving that basic information. And then we recommend that tying back, if people are moved by the story or interested, to contact the transplant center, not the patient.
We've got another question. Our good friend Heather.
Okay.
She's back. She says, what do you think of the opt-out policy for deceased donors that many European countries have started? Do you think it would benefit the U.S. and reduce wait times for transplant? And do you think something like this could happen in our country, or is there too much red tape politically?
Oh, that's a tough question. Thanks, Heather,
That's
for
a
that.
lot.
So there are two components to that. And I think there's the social component, the difference between some of the European countries and U.S. are just general philosophies about health care and about what we do with our bodies personally. Spain is a country that I think she's speaking of, and Spain has more of a opt-in option. If a person happens to have an event that they succumb to, then you're a presumed donor. I'm not sure that goes over well with the idea of freedom here in the U.S. and people's personal belief about that. I think that's more of an issue than regulatory issues. Regulatory issues and concerns, I think, would come into play later. But implementing that and putting that into place, distinct differences between people socially in Spain and in the U.S.
Who should you contact if you want to be a living donor, though?
Oh, to be so that topic was deceased donation. And just to segue on that point, though, I would say as Dr. Randall pointed out, it's controversial. There are countries that have had success where it has increased deceased donation rates, and actually countries where it is not, because the family still has the right to pull back. So lots of controversies in that regard. For people interested in living donation, they should contact a transplant transplant. I mean, you could, if people are it can depend on relationships. So if I wanted to donate to Dr. Randall, I felt close to I might say I want to look into this, but the point is that people can contact a transplant center completely privately, confidentially, and move forward in that safe manner.
Right.
Great. Where can we find more information about living donation?
Good sources of vetted. So there's tons. We talked about the internet this afternoon, and perhaps a note to be cautioned that not everything on the internet is accurate. So to look at information with that lens, and I would direct patients to the sources of vetted information. The National Kidney Foundation, the United Network for Organ Sharing has some educational resources that are developed both specifically on the topic of living donation at kidney patients in need of finding a living donor, and it talks about a lot of the strategies we just went through, as well as a brochure directed at living donors describing the process and the risks and so forth. Professional societies like the American Society of Transplantation have toolkits for living donors as well that discuss health issues, financial issues, those kind of sources.
Good. Who do I contact to find out if I am able to donate a kidney? I'm going to quiz you on the number here. What's our transplant center's number?
I don't know. I actually don't have that number
doesn't know.
committed to memory.
Yeah, it's okay.
I'll be honest
So
about
the
that.
SSM Health SLU Hospital Transplant Center's phone number is 314-577-8867. I didn't mean to put you on the spot.
8867.
So really, we've had some great engagement on social media today. Thank you everybody for your questions, and thank you Dr. Lentine and Dr. Randall for joining us today. We're running out of time. I know we're ending a bit early, but we have no more questions really. So thank you again for sharing your thoughts about kidney transplantation and the benefits of living donation with our audience today. Content for today's Q&A was provided by the National Kidney Foundation. To find out more about how to find a living donor, sign up for our upcoming NKF Living Donation Workshop on September 8th. And the website will come up on your screen here. It is www.kidney.org/BABG/MO. And I hope that you join us next time.